Welcome to Keysteps Wellbeing, where luxury meets needs podcast. And super excited today. We have our very own Dr. Cyrus Abbasian. Welcome to the podcast. I guess before we get into it, 'cause we're going to be talking about ADHD and addiction and mental health, tell us a bit about yourself and what led you to specialize in addiction and psychiatry.
So I'm Cyrus Abbasian. I'm a consultant psychiatrist, and I'm a Londoner as well.
Mm,
So I've worked and trained in London
mm,
all my life. I trained at the Maudsley in South London,
okay.
and I worked for NHS for 23 years,
Mm,
and now I just work privately. And I became psychiatrist because I was curious, and
mm,
I wanted to understand mental illness, and I wanted to be able to help people with mental health conditions.
mm.
So I'm a general adult psychiatrist. Basically, I see patients between the age of 18 and 65 usually. And also I'm an addiction specialist.
Mm.
And more recently, I know how to diagnose and treat neurodiversity in adults, in particular, adult ADHD and adult autism.
Brilliant. I really want to get into a bit of that today, Dr. Bastian, and because there's so much conversation about ADHD. I mean, over the last, I say 5, 6 years, the conversation about ADHD has been huge. I was even having a conversation in a sauna with some of the guys in there, and lots of different myths and beliefs. But I guess one of the things I want to ask you is, I mean, there's been a lot more awareness of ADHD recently, and why do you think it's important in conversations about addiction, in connection with addiction and people that have ADHD? What Tell me some of the important conversations around that.
Now, I mean, there are two separate conditions here. Obviously,
Mm.
you have ADHD, which is neurodiversity
Mhm.
type condition, and addiction, which is basically when you take a substance more than you should and you lose control and the substance controls you.
Mm.
In sort of very, very basic terms. Now, with ADHD, this concept of dual diagnosis is important.
Okay.
So ADHD can lead to many other mental health conditions, including addictions.
Oh, wow.
And it is recognized that people with ADHD and all psychiatric conditions can self-medicate with alcohol and substances. And this is why early diagnosis and early treatment is
Mm.
important. And it's not uncommon for someone with ADHD to self-medicate with stimulants
Right.
or drugs that are uppers,
Mm.
such as cocaine or amphetamines or MDMA.
Okay.
And it's important for us to fully diagnose in these individuals and have a comprehensive treatment plan in place
Yeah.
that takes into account treating the ADHD as well as their substance
Wow.
misuse.
Wow. Wow. That's really interesting. Okay. What sign might suggest someone should consider being assessed for ADHD, and can treating ADHD make recovery from addiction easier?
Well, yes, I mean, it's really important to have a bespoke care plan
Mm.
uh, around the patient. So unfortunately, we have services that are very separate,
Mm.
and they don't necessarily communicate with each other. So you have a ADHD service that rejects people who use substances,
Yes.
and vice versa.
Mm.
So this kind of piecemeal way of delivering service is not it's not good for the patient.
Why is that? What is that about, do you think, that separation? I mean, from your experience, I mean, what's that about, do you think?
I mean, within the NHS, it's about service development.
Right.
Partly, it's about how funding is allocated.
Mm.
It's also in America is driven by insurance companies and
Course.
how they categorize
Course.
mental illness.
Course.
But I think we're in a unique position that we can have a patient and have a treatment and care strategy put around them
Absolutely.
and get all the right people. You can get the dietitians involved, the nurses, the specialists, and other people, and that can
Absolutely.
really help to have a proper care plan in place in the short term and in the long term. And someone with dual diagnosis of substance misuse and ADHD, it's important to manage both conditions simultaneously
Okay.
and not sort of say, okay, let's focus on this first and not the other.
Can you tell us a bit more about that, Dr. Bastian? Managing it both simultaneously. Tell us, is that
Yeah.
possible?
So again, so briefly, ADHD they have three sort of subcategories of symptoms here.
Okay.
So it's inattention, hyperactivity, and impulsivity,
Okay.
and it is present since childhood.
Okay.
It doesn't just appear in someone when they're 21 or 22, for
Right.
example. And the way they use substances tends to be different.
Okay.
So a typical substance user, they get euphoria, they get the buzz. They may have other mental health, such as depression, anxiety,
Sure.
and they tend to start by medicating. Well, not medicating, using drug on the party scene with
Okay.
their friends, with their mates on Saturday night, and they kind of it increases more and more because of tolerance. But with the ADHD, the kind of microdosing is more recognized.
Okay.
So they use cocaine throughout the day in really small amounts. And what they tell you is that they don't feel euphoric with it. They just feel normal. And one of the key questions is that I ask patients with ADHD is that, have you used drugs before? And if so, what effect has it had on you? And what they say, yeah, doc, I had a bit of Charlie or, cocaine, and it actually calmed me down. I could think. I was relaxed and I felt normal.
Yes.
I mean, as other people, when they take cocaine, they're fairly euphoric and energetic.
Yes.
That kind of paradoxical response to stimulants is one of the crucial symptoms that we're trying to elicit.
Wow. So basically what you're saying is that these particular stimulants that you just basically described, somebody that's got, ADHD from an early age, they get into the kind of party scene. But what I'm hearing you say, they find is that, how the stimulants would affect somebody with non-ADHD is different to someone with ADHD, because the person with ADHD, it calms the thinking down, it calms their mind down, where their mind might be running. Is that what you're saying, basically?
Yeah, basically.
Basically.
I mean, what happens in the brain, the scientific evidence that we have shows that they have lower levels of dopamine, which is a neurotransmitter.
Got you.
And the low levels are fluctuating all the time.
Right.
And what the treatment that we offer, which is stimulants, and also in some ways what the cocaine or amphetamines illicitly does, it normalizes and increases the level of dopamine in the brain.
Wow.
And that's what helps the patient.
Dr. Abbasian, I mean, what signs might suggest someone should consider being assessed for ADHD?
So the core symptom is inattention, and lack of attention or not having any sort of ability to attend to something as fully as they should.
Sure. Are you able to, just for our audience, just for those who maybe don't are you able to break down each category?
So, I mean, there are like 7 or 8 crucial questions we ask patients.
Okay.
And we have all become less attentive in recent years because of social media.
Of course.
Because of internet and email and phone. I mean, back in the day, when we went out on a Saturday night, we met at a particular place at 8 p.m.
This is what we was talking about.
If you didn't turn up, you would miss the party.
Absolutely.
And we got along fine.
Yes.
And and I think when answering machines came, that was the first invention. Oh, okay, let's call someone and leave a message for them.
Yeah.
But I mean, the lives have changed, and we have all become less attentive. There's so much going on right now. We have Netflix, we have so many apps, there's so much entertainment. So that is separate from ADHD as a diagnosis. ADHD is a neurodevelopmental condition that is present since childhood. And often the parents tell you that, the little Johnny was really chaotic, really all over the place, couldn't sit down, was hyperactive, was running around full of energy, and couldn't just sit down and read anything or learn. And often is problematic from school days. And the lack of attention is so much so that they may not be able to attend to anything at all, which is the extreme end of the spectrum. And it's really damaging because we live in societies whereby adequate attention is important for whatever we do.
Yes.
Whether you're a doctor or a plumber or whatever profession you have, you need to do things in an organized way.
Absolutely.
And for that, you need to have adequate amount of attention. So if you just focus on one thing and you get distracted and you focus on something else and on something else, it's harmful.
Absolutely. It's interesting you said that. I was speaking to a few of the guys that go to the sauna, and we were speaking about it a few days ago, and he said that, he grew up in a village in France, and he said that the early days, the most that you'd get is probably like the newspaper. You'd read the newspaper, you'd find out what's going on in the community, and you know, there might be the local lady in the village that was keeping up with the local gossip, and she'll tell you exactly what's going on in the village. And then that was it. You go, you had a particular time, you had to be somewhere, you had to be there at a particular time. And just like what you're saying, with now how society is now, it's interesting about an answer machine as well, which is quite interesting. That kind of brought me back memories when I was growing up. You know, the answer phone.
Life was much simpler.
Yes, 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 absolutely. So you can see now with all the tabs and all the information, all the data that we're receiving, you know, I can totally get it. So it's really interesting. I guess, I mean, a role of a psychiatrist, Dr. Abbasian, I mean, tell me generally, just like a role of a psychiatrist, really, because, you know, just some myths, you know, I meet a lot of people, and a lot of people, you know, I speak to, and I think maybe, I suggest maybe it might be good if you see a consultant. No, I'm not seeing a consultant. I mean, tell me just a bit of a role of a psychiatrist for our audience, you know.
I think there is stigma. Stigma is much less now compared to before, but it still exists. And the idea of seeing a shrink or a psychiatrist or a head doctor can be scary for a lot of people. So if your arm breaks, you've got no hesitation with going to A&E, seeing a doctor, having an operation to have your arm fixed. But if your mind breaks, which happens more commonly probably than arms and legs breaking, you feel ashamed. You think, oh, well, I don't know, they might lock me away. Nonsense, you know. So there's a kind of, they watch One Flew Over the Cuckoo's Nest and have these old images of asylums, and this is why they're less likely to get help for mental health issues when their mind breaks. But stigma is much less now than before. And there's the fear regarding, you know, will I get better? Will I get addicted to drugs? Will medication make me worse? I think it's important, if you have mental health issues, depression, anxiety, whatever, seek professional help.
Absolutely. I really like that, you know, someone's, you know, hurt their arm, broke their arm, or they have no hesitation to go and get X-ray. I like the way you framed it. It's on, you know, people's minds do break, actually, you know, and it can happen at any time. So, I mean, this is a really good conversation, and I guess, you know, I mean, what would be, I mean, what would be like what would actually happen in the first appointment? Someone comes to see Dr. Abbasian and they say, look, I want to, I mean, what would kind of be, what would you do, just so for our viewers, what would you do if someone needs to see you or see a psychiatrist?
So I usually do an initial assessment. Prior to that, I usually have some triage information. I usually get a GP summary. I need to know a bit about the background of that patient. And then the initial assessment takes up to an hour. And it's quite comprehensive. I also ask about their background, childhood issues, any traumas. And then after the initial assessment, usually I can formulate a plan based on potential diagnosis or diagnoses. And then if it's with Keysteps, you know, I discuss it with yourself, your MDT, and we discuss what the best way forward is, and we put a team of professionals around that patient to take their treatment forward.
Perfect. And, you know, one of the big things I always get asked, you know, I don't want to take medication. They say, I don't want no medication. But I think, you know, coming from a therapeutic background and understanding medication a lot more now after the years I've been in working in the industry, I guess, is, how do medication, from your perspective, medication and psychological therapy work together? Because I know you're really big on that as well. So, I mean, how does it work together? How does it marry up? And
I mean, regarding medication, I don't want to take medication either. I mean, all medication have side effects. Even the paracetamol that you get for headache, that has side effects. And we have to balance how effective medication is versus the side effects. And even though I'm a prescriber, the first thing I do is to come up with a plan that doesn't involve medication. And that kind of health and well-being stuff is so important.
Absolutely.
A lot of patients that we have, they have really damaging lifestyle.
Yes.
They drink a lot, they use a lot of drugs, they work more than they should, they haven't got a work-life balance, they don't do enough exercise, they eat unwell, eat unhealthy, sugary, fatty stuff. You know? So having a good lifestyle coach or just changing someone's behavior in terms of well-being, lifestyle measures is a really important first step. And then after that, we can consider therapy, and after that, we can consider medication. And usually medication is recommended for more moderate, severe mental health conditions. If therapy doesn't work, if lifestyle well-being stuff doesn't work, if they cannot really, if they're too ill, they're too depressed to do anything else apart from take medication, then there's an important role for medication. It's like a stepped care approach. You try things. If it doesn't work, the next step is try.
I like that. I mean, it's really good to hear, your approach around medication and psychological therapy. I think it's really important. But going back on what you said about some of our clients that come to see us, some of them are, one would describe them from looking from the outside in, that they're elite, they run, great businesses, they're super wealthy, they do all these great stuff, and they've got all this money. But equally, how you describe their lifestyle could still be really, devastating, where there's drug use, there's eating unhealthy, engaging in, unhealthy sexual practice, etc., etc., etc. And I guess that, kind of thinking about what you're saying around, medication and psychological therapy, and your approach to treating it is very important, because a lot of people that we meet, their thing is, I don't want a medication. So, but I really like that fact that it's a step approach. Let's
Step care.
I really like that.
So basically, I'm a prescriber, but I dislike prescribing medication. And I think medication has an important role, but other stuff is more important.
Absolutely.
So, all medications have side effects, and we have to basically find out whether the effectiveness of the medication is more than the side effects. That balance is important.
Absolutely.
And medication is part of the care plan, Lifestyle well-being is important. Some coaching is important. Therapy is important. Is the patient sleeping well? Are they, have good routines? Are they working for less than 40 hours a week? Are they exercising? Eating a balanced, nutritious diet? All these factors really can affect someone's health and well-being. And usually, for more severe mental illness, is when we definitely prescribe medication.
Okay. I mean, I guess I've got another question, which is a big one. When might medication be helpful? When might therapy be enough? Bit of a...
Again, at the end of the day, it's the therapist that decides after discussion with the patient.
Sure.
We have sort of short-term interventions, intermediate term interventions, and long-term interventions. And typically CBT, cognitive behavioral therapy, you need at least 6 sessions. It could be 6, it could be 8.
Is that minimum 6 minimum?
Minimum, usually.
Okay.
And sometimes up to 16 to 18 sessions, depending how severe the condition is.
Sure.
Counseling can be more extended, up to a year, and then psychotherapy could be sometimes several years.
Sure.
There's so much horses for courses, really.
Yeah, of course,
It depends what the patient wants and what the patient needs.
Sure.
I don't like lifelong therapy. I mean, I've had patients who've had therapy for years and years. Well, I'm thinking, is that really effective? Treatment should be time limited.
Yes.
And it should incorporate other aspects as well.
Absolutely. Absolutely. Another big question, as you know, I speak to lots of family members. Lots of family members, they ask me loads of questions. Sometimes I can't answer them. One of the things family members, what should family members understand about someone living with ADHD and addiction, or even just ADHD generally? What should something that family members what could be helpful for them from your perspective?
I mean, family members should be involved. And as part of the ADHD assessment, we usually get a parent to complete an informant report.
Right.
Regarding the person's childhood.
Okay.
But it's a neurodevelopmental condition. It's present since childhood. And so sometimes patients don't have full recollection and understanding of what they were like when they were children. Because they can't remember.
Yes.
They can't attend on something, your memory is poor. That forgetfulness, disorganization, losing things is one of the features of ADHD. And so sometimes you can have really chaotic families, and the problem could be within the family. So having a proper family therapist in place to provide care is important.
Sure.
But having a destigmatized approach is crucial as well. Because sometimes families are really against mental health input.
Yes.
And they encourage their you know, their relatives not to seek treatment because
Yes.
of the stigma
Yeah.
associated with mental health.
Yeah, I get that a lot. We want them to have therapy, we want them to see a psychiatrist, but how you meant to get them diagnosed, it doesn't.
Yeah.
I think the other one to ask is, employers, educational settings, we get a lot of students and employers, they don't understand. They have, people that work for them and they don't understand ADHD or educational settings. But I mean, how can employers or educational settings better support adults with ADHD? How do you think? I mean, what could they do to help?
Well, I mean, employers should have access to occupational health
Sure.
organizations who have specialists who could be occupational health trained, or they could refer on to psychiatrists or mental health professionals. And then once a diagnostic assessment is undertaken, then there can be discussion about reasonable adjustments to be put in place.
Yes. Yeah.
And so one reason that employees struggle at work is because they're neurodiverse.
Yeah.
If you have ADHD, then it's very difficult to go to work on time, sit behind the desk, and do what's necessary.
Absolutely.
And some reasonable adjustments, such as flexible working remotely, working, in your own time, could be suitable. But obviously, the employer needs to get value from their staff as well.
Absolutely.
So it could be target based, as long as that a member of staff with ADHD, through appropriate coaching, as long as they meet their targets, then the employer should be happy.
Yeah.
And they shouldn't discriminate against people who are neurodiverse, because these individuals do have these superpowers, these
Yes.
abilities that the rest of us may not have. It's really important to sort of bring out all the positive aspects of having neurodiversity.
Perfect. Oh, I'm always excited about these kind of questions. I mean, are there any like exciting developments or research that you can share with us?
I mean, in recent years, ADHD has become more understood and more mainstream, and everyone knows something about ADHD. And there's this debate whether we're over-diagnosing it or not. It lies on a spectrum of severity, and those at the severe end of the spectrum, I mean, even a layperson can tell you something not quite right with them. So it is a bit tricky in the more gray areas.
Sure.
Whether you give the diagnosis or don't give the diagnosis. And usually, I'm an adult psychiatrist, so by the time patients come to us, other interventions have been tried.
Yeah.
So they've had treatment for depression, for anxiety, they've had therapy, they have other stuff. They're usually ready for medication, and stimulant medication is the first line according to the NICE guidelines. It works very well. And we usually start them on stimulants. You may have heard of Concerta or Elvan,
Elvans, yes.
which can work remarkably well. And about 1 in 3 patients say that it's life-changing for them. It's like a switch in the brain that was turned on. 1 in 3 don't respond, unfortunately, and another third do reasonably well on it. So much so that they say, okay, it's good enough. I take it, and I can take it as needed. And with medication, again, we advise coaching, lifestyle measures, reversible adjustments in line with the Quality Act. In terms of new medication, I mean, there's some, they're looking at non-stimulants as possible options in the future. And I suspect that we will be prescribing more non-stimulants. So briefly, stimulants are medications such as Elvans and Concerta, which is, it's amphetamine-like medication, amphetamine metabolites. Non-stimulants is tamoxifen is very commonly used.
Quick question, sorry to interrupt. So if I drug test someone, as we normally do sometimes, and they say, I'm abstinent, not using, I mean, will it come up with amphetamine on their drug test?
It will show.
Okay.
It will show. But the lab will be able to tell you whether it is prescribed or is illicit.
Perfect. One question, is there a link between menopause and ADHD?
Yeah, I mean, there's a link between menopause and menstruation on all mental health conditions. And this is a question that we should ask. So there's a question I always ask is whether your symptoms get worse leading to your menstruation. And if that particular age, I'll ask about menopausal symptoms and whether the condition gets worse or better over menopause. And most mental health conditions change as the patient or the person ages.
Right.
And women who actually are underdiagnosed with ADHD. So the traditional ADHD was considered to be a little boy's condition.
Yeah.
And there's a discrepancy, I think 4-1 or 5-1 in terms of diagnosis.
Wow.
But we're getting better at diagnosing women with ADHD who tends to have the more ADD type, so
Okay.
inattentive type. They don't have the hyperactivity to the extent that boys have. And it is recognized that the ADHD symptoms, so inattentiveness, and the sort of the agitation and irritability associated with ADHD gets worse in the 5 days leading up to menstruation,
Wow.
and in particular gets worse around menopause. And increasingly, we're getting women in their 40s who are presenting with ADHD. And what they often tell you is that, yeah, they've had these symptoms all their lives, but they could manage, but they no longer can manage. And part of the treatment includes seeing an HRT, a hormone specialist,
Okay.
to diagnose, hormone replacement, as well as ADHD medication, if
Okay.
indicated.
Wow, wow. And I know we spoke earlier about racial minority, maybe. I mean, tell me a bit more about that in ADHD as well.
Again, people from racial minorities are less likely to have to come forward from any mental health condition, and also all health conditions.
Yes.
We look at the data, the NHS data in particular. Racial might tend to do worse
Yes.
when it comes to treatment for cancers and all health conditions. And I think that's, again, partly because of stigma.
Yes.
Stigma in mental health. There's a cultural taboo.
Yes.
Or don't see a shrink, they're going to lock you up.
Yep. Yep.
So again, that's something that we need to combat.
Absolutely, absolutely. I know growing up, I remember, your psychiatrist is not, no way, you go and see a psychiatrist,
Yeah.
definitely something's wrong with you, but it's more, I guess what I'm hearing from you, it's important and more welcoming, and based on conversations we've had already about medication and that medication is not always the first course,
Yeah. And also in men in particular. I mean, the commonest reason why men die in this country at the age of 20 and 50 is suicide.
Yes. Yeah.
And we have to talk about it. We have to put strategies in place.
Yes.
I mean, why are so many men killing themselves?
Yeah.
It's just,
Yeah.
and if they seek help early, then they're much less likely to kill themselves.
I mean, it's a big question. I mean, what could they do? I mean, it's a wide question, but
I mean, the first step is to talk to someone.
yes.
I mean, if you're feeling suicidal, if you talk to someone, it means that you don't want to kill yourself. It usually is often the people, the men who plan,
Yeah.
and no one really knows. There's a last note, and everyone's really shocked. Oh my God, Johnny never told us that he was feeling like this. And parts of feeling ashamed, stigmatized, they thought they're going to be believed. They thought it's weakness. Yeah, they say they're depressed and suicidal. And it's really important to say back, you have a mental health condition. In the same way that your arm breaks, your mind could break as well.
Yeah,
if you need to have treatment, do go and have treatment.
If you could leave our listeners, Dr. Abbasian, with one key message about ADHD, what would it be? One key message.
One key message, I suppose, is that get appropriately diagnosed if you believe you have ADHD. And go to a specialist. They may not be a consultant psychiatrist, but someone with many years experience in diagnosing mental health issues and ADHD. And I mean, ideally, someone who has a broad experience in medicine, in psychiatry, as well as in neurodiversity would be ideal.
Perfect.
Because it's not an easy condition to diagnose. And I know GPs increasingly are being trained up to diagnose it.
Oh, wow.
But you do need to have a broad level of experience to be able to diagnose and manage it properly.
Wow. Thanks for coming, Dr. Abbasian. But before you go, we have the quick fire session.
Yeah.
Hot seat. Right. One myth about addiction.
One thing about addiction.
One myth about addiction.
One myth about addiction. Oh, you got me there. One myth about addiction. It doesn't exist.
Okay. One thing you wish every family knew.
About treatment strategies available in mental illness.
Cool. One piece of advice for someone considering to get help.
Do get help. Speak to your GP first, speak to a
Yeah.
NHS provider or a private provider. And yeah, definitely get help. Don't wait too long.
Cool. Last one. One thing that gives you hope in your work.
I think, I mean, stigma is a biggie here. And I think the mental health and addiction is becoming more destigmatized. And people are more willing to see specialists for help and support,
Brilliant.
which is really important.
Brilliant. Amazing. Thank you, Dr. Abbasian, for coming
Thank you.
and
Thank you for inviting me.
sharing your experience.
Thank you.
Amazing.
Thank you.
Fantastic.